Hi, I'm Steve Adubato. Thanks for joining us remotely. We're talking about childcare and related issues. We're honored to be joined once again by the Honorable Commissioner of the New Jersey Department of Human Services, Carole Johnson. Commissioner, good to see you.
Good to see you, Steve. Thanks for having me.
Let's get right into this. We're taping on the 24th of June. It'll be seen later, but there have been grants that your department they haven't given out, people have earned them to childcare centers to, quote, meet health and safety guidelines connected to COVID-19. What are they for and how will they help?
Oh, thanks for the question. The governor announced that as of June 15th, childcare centers could reopen, meeting new health and safety standards. And so our colleagues at the Department of Children and Families put out new health and safety guidelines for what childcare centers needed to do with respect to ensuring that children were cohorted into groups and interactions were limited and minimized so that risk could be minimized in childcare centers. What we want to do is make sure parents have confidence, staff have confidence in the health and safety of returning their children to childcare if they need to. And so what our department did was made up to $20 million available to childcare centers and summer camps across the state to help them meet these new requirements, because we recognize that PPE costs money, new extra cleaning supplies cost money. Maybe you need more toys so that you don't have as much sharing of toys and a host of things like that. So we wanted to make some money available to centers to be able to comply with these new standards.
Along these lines, Commissioner, the bigger picture. Again, our job is to look at the longer term implications of COVID-19. The job of NJTV News, of Metro Focus, our PBS and our region partners and colleagues, they will report on the news every night. They'll make sense of it as well. We look at the longer term implications along those lines. What have been, in your view, what are the most devastating and long-term impacts of COVID-19 on, there's no other way to say it, the family?
Look,
And it depends upon what families we're talking about as well.
Yeah, it has been very challenging, we know, for families to accommodate compliance with the stay-at-home order, and they have done a remarkable job doing it. But families have had to change their patterns. They've had to, homeschool their children. They've had to figure out if they are essential workers. They've had to carry the strain and stress of being out in the public every day and coming home to their families. There's just been so much stress and strain put on families that we're very anxious and worried about and want to make sure that we have supports and services for them. So we have been working. We've secured some federal resources through FEMA, some federal resources through SAMHSA to really build out.
FEMA is the Federal Emergency Management Agency, and the other acronym is?
SAMHSA is the Substance Use and Mental Health Services Administration. It's part of the Federal Department of Health, and they are the agency that helps us as a state with resources and supports for mental health and emotional support. And so we access some funding from them to be able to really build out. We're partnering with Rutgers, we're partnering with Catholic Charities, we're partnering with a lot of agencies across the state to try to be able to do mental health supports for frontline healthcare workers, for families, for all of those individuals who have really, there are many individuals who had mental health concerns prior to this event that we have worked with, but there are many people who may not have been known to our systems who have really struggled through the challenges of what happened during the pandemic, and we want to be able to reach those individuals.
Commissioner, the other thing I'm thinking about, that it's not just me, it's many of us in the media and average citizens, thinking about the connection between the ability to safely go back to work and its connection to childcare, and childcare's connection to safely going back to work when a business with the state and then the federal government's approval says it's okay to go back under these conditions. So it's a long-winded way of getting to this question. What is the connection between childcare and work and the larger economic issues, social, cultural, et cetera?
Absolutely. And I appreciate you raising that, because childcare is part of reopening the economy. It has to be.
You can't just separate it as that issue.
No, we saw that during the pandemic. The height of the pandemic, I should say. We are still in the midst of the pandemic.
We don't know where, we can pray, but we don't know where it's going to go and when, as Dr. Fauci often says, the virus will often dictate reality. Go ahead,
That's
please.
right. But at the height of the pandemic, when we in New Jersey and New York were the leading incidents in the country, we stood up emergency childcare, a brand new program to provide childcare to essential workers that we subsidized because we knew that childcare was what it was going to take to make sure that those individuals could be on the front lines. And so childcare was absolutely essential. And the childcare workforce and the childcare centers that raised their hand and said, yes, I'll be an emergency childcare center, are part of the story of why frontline workers were able to do the incredible heroic work that they have done. And going forward, we know that as we bring more businesses back online, those businesses are going to depend on childcare to ensure that their workforce can be there. And that's why we have really been focused on helping childcare centers with the resources they need to be able to reopen. We as a state have also committed to, we have continued to fund our subsidized childcare slots, even though children are not in those slots right now, but we've continued to fund them so those slots will be available to children as childcare centers come back online and parents make decisions about going back to childcare centers. We also are working with our family childcare providers because individuals might make that choice going forward. We know that families, the key issue here is for parents to have confidence in sending their children back to childcare so that they can then also have safety and confidence in going back to work. Childcare has always been about the educational development of children and the economic sustainability of our state.
You know, this entire program is dedicated to childcare issues connected to the family, but I'm curious, Commissioner, there are very specific safety measures. Now, you talked about it before. There's social distancing. Here's what I'm trying to understand. In a childcare center, if there's more social distancing, could the state also say, this is the limited number of children in a childcare center, this is how far apart they should be, this is who's wearing a mask or not in September? Again, we're taping in late June. Could all those things be put in place for childcare centers?
Absolutely, and that is what's happening now. In fact, I went and visited an emergency childcare center where everyone's temperature is taken outside. Parents don't actually enter the childcare center. They turn their child over to an individual who works there. As soon as the child comes in, they wash their hands. There's a station right inside for the children to wash their hands. They have redone the footprint of their childcare center so that they ensure that all of the shared toys are put away in a space so that that isn't happening as much, and individuals have their own boxes of toys. The children over 2 had masks on. This is what's happening in childcare now, and our colleagues at the Department of Children and Families are out working with childcare centers every day to make sure that they can comply with these new guidelines.
Commissioner Carole Johnson of the New Jersey Department of Human Services, every time you join us, you not only shed light on these important family issues, childcare issues, you help us also understand what needs to be done moving forward, even though we can't predict what this virus will do. Commissioner, thank you so much for joining us.
It's a pleasure. Thank you, Steve, for your continued attention to this really important issue for families.
Thanks so much. I'm Steve Adubato. We'll be right back.
Think Tank with Steve Adubato has been a production of the Caucus Educational Corporation. Funding has been provided by PNC, Grow Up Great, the Turrell Fund, supporting Right from the Start NJ, the Robert Wood Johnson Foundation, Atlantic Health System, New Jersey Sharing Network, the Northward Center, the Healthcare Foundation of New Jersey, the Fidelco Group, and by Johnson & Johnson. Promotional support provided by the New Jersey Business and Industry Association and by New Jersey Monthly,